In our Phase 1 Grand Challenges Canada project, we designed and developed the Aquila system, which is a chip and instrument to perform malaria diagnosis at the point of care. And during this phase, we did a laboratory validation using almost 200 clinical samples that were collected from pregnant women in Uganda who had malaria. The Aquila system performed far better than any of the technology that's currently available for malaria diagnosis in the field. We were able to detect as little as 10 parasites in a drop of blood, whereas other technologies can only detect about 1,000.
Aquila Diagnostics has since taken that early prototype that was developed in a University of Alberta lab and have built now a pre-commercial system that can actually be deployed into the field for many of the biological applications that we're interested in as part of this application. So this technology is really exciting because it allows us to do multiple things. It allows us to look for many different targets within a single drop of whole blood. It allows us to store our chips without the need for refrigeration. The cartridges or chips themselves are low cost, and we actually use off-the-shelf electronic components in our instruments, so collectively the technology is relatively inexpensive.
Aquila Diagnostics has worked closely over the last few years with Dr. Stephanie Yano to develop the Aquila system. We think this is the perfect system for field deployment into Africa. We have a low-cost, disposable plastic chip that's produced by our partners in Australia, Minifab, through an injection molding process. We also have a low-cost instrument. This is also an instrument and a testing system that's ideal for testing in the veterinary industry for livestock in Alberta. And this is one of many applications that we're pursuing with this platform.
In Phase 2, we're going to add more tests to our chip so that we can determine which type of malaria, as well as identify other common causes of fever. In the final step, we're going to bring our Aquila system to the field and do a field evaluation with our partners with the Ministry of Health of Uganda and the Foundation for Innovative New Diagnostics.